In this video, we are going to be talking about the lateral collateral ligament, also known as the LCL. The LCL is part of a complex ligament structure called the posterolateral corner. And so the LCL itself isn't often injured in isolation. It's often injured as a part of that complex, the posterolateral corner. But similar to the MCL, the LCL could be injured by blunt force to the inner side of the knee, which forces the knee into a bow-legged type of position, which we call varus, and that could result in the injury. But often the LCL, or the posterolateral corner, is injured in association with another ligament injury, and even other injuries to the inside of the knee, like the cartilage or the meniscus. And so an examination is key to properly diagnose this, to properly determine just how badly the ligaments are injured. But it's also important to have an MRI to confirm and to rule out some of those other injuries to the knee. And so in this video, we will discuss the anatomy of the LCL and what its function actually is. And so hopefully you guys find this video helpful and informative. In this video, we are talking about the lateral collateral ligament, also known as the LCL. So this is the medial side of the knee, which is the inner portion of the knee, and the outer portion of the knee over here is the lateral side. And so the lateral collateral ligament attaches to the thigh bone, and it runs down past the knee joint and attaches to actually a smaller bone on your leg called the fibula. So you have your big shin bone called the tibia, and then the smaller bone is called the fibula. And that's what the LCL attaches to below the knee joint. If the knee is struck from the inside, so you can imagine a force that comes this way and strikes the knee, this is going to force the knee open like this. And so as that knee opens up, you can see how that strains this ligament right here. And of course, if you have a small amount of force, you might have just a small sprain. But if you have a lot of force coming across the knee, this will open the knee up and you can have a rupture of what's called the LCL. As mentioned before, the LCL is part of a big complex called the posterolateral corner, and that's not completely described on this model right here. But the posterolateral corner also includes what's called the popliteus tendon, which is actually a muscle tendon and not necessarily a ligament, and that attaches very close to the LCL. So again, if you see a lot of force coming through the knee, you can see how that would strain things. And often an isolated injury here is not very common, and usually you're getting an opening injury, but also some sort of rotational type injury to the knee that can result in a big injury to this whole posterolateral complex.